I've heard lots of stories from frontline workers who were confused about what to do when patients would come in, or what to tell patients so they wouldn't have to be hospitalized, because there's that early, like 2-week period where you can do stuff at home. And then if you don't treat yourself the best you can, a lot of people end up at the hospital, and that's another whole, it's so crazy. There's something going on there, it's still a work in progress trying to figure out what's going on, but it's not conspiracy. There needs to be more talk about what doctors are actually doing for treatments. And doctors aren't the same as virologists or immunologists or ophthalmologists. They're different sciences and they're focusing on different things, right? So, and you have to be a scientist to know that.
I mean, it is a constantly changing situation. It's a new virus, and now there are variants, and I'm relatively patient about it, because about what the supposed people in charge are saying and doing, because nobody really knows what the hell is going on, basically. And so err on the side of caution. I've gotten in trouble with people for saying that on Twitter and everything. Wear a mask, wear a freaking mask. And if you're able to get a vaccine, if you're afraid that you're going to have a bad reaction to it, or you have bad reactions to vaccines in the past, well, then, that's your prerogative not to get a vaccine, or if you have cancer or other things where you're afraid your neck will swell up and you won't be able to breathe. I know people like that too, who are undergoing cancer treatment. So there are valid reasons for not getting the vaccine.
And there's a lot of people that they get labeled anti-vax just because of these particular vaccines. I mean, there's a lot of vaccines that have been tested for decades and very effective, and people have had different kinds of reactions, and they make those personal decisions. But I think if I'm concerned also too, if you take informed consent away from people, that's serious too, in many, many ways.
Right.
Because at least there is an option, right?
Right.
And if you don't have an option, that's, it's crazy.
Well, if this country had treated its citizens better by allowing them their right of free healthcare and access to it, universal everywhere, then there wouldn't be so much suspicion against the health industry. There wouldn't be such suspicion against healthcare providers and doctors and lab technicians and researchers, in my opinion, because if you're afraid that you're going to go into debt by going to the doctor, and you have been treated well in the past by doctors or health insurance companies, then you're going to have a natural suspicion and aversion to even trusting them. And that's
I agree.
my lecture.
There might be a miracle drug, and then there might be, something that really needs more testing. There might be a good doctor, and there might be a bad doctor. I mean, it's a mixed bag.